Today we are going to discuss about the renal system. Particularly here, we are going to focus on kidney disorder or kidney disease. In this part, we will talk about the acute renal failure and chronic renal failure, right? So before to go, acute renal failure or chronic renal failure, I want to give a focus what are the basic cause of the renal problem or renal disorder, right? Or what are the risk factor of renal disorder? So this risk factor basically for acute or chronic both. So if I go and have a look one by one, chemical substance or environmental toxic exposed to the kidney. So if anybody exposed to chemical substance for a long time, they chance to develop the kidney problem. Chemical substance including any pharmaceutical medication or some drugs are toxic for your kidney. It's called the nephrotoxic medication. Example, gentamicin, vancomycin, aminoglycoside, or some non-steroidal anti-inflammatory medication or pain medication. Also, the contrast sports can cause the renal damage. Diabetes is one of the most important cause of renal disease. And diabetes, if it is uncontrolled, can cause the chronic renal problem. Or family history of renal disease. So some people has a chronic renal problem. It is called glomerulonephritis. So glomerulonephritis, one of the important cause of the renal problem, especially chronic renal problem. So glomerulonephritis, it is actually immune complex disorder resulting in inflammation of the glomerular of the kidneys. So also the frequent urinary tract infection. So if anybody frequently attacked by UTI or urinary tract infection, it is causes the bad effect on your kidneys. Particularly UTI or urinary tract infection in the lower urinary tract, there's some organism like E. coli or Escherichia coli can cause UTI. So there's some risk factor related to UTI like female gender because of short urethra or close the proximity to the rectum, menopause women, sexual intercourse, pregnancy, right? So it frequently causes UTI. If UTI not treated well or maltreated, repeatedly occur, they causes your kidney problem. Heart failure. So if anybody's heart failure or myocardial infarction, the perfusion of the blood is reduced, cardiac output reduced, and they causes the kidney problem due to reduce the perfusion of the blood to the kidneys, right? And kidney function significantly going down. The other most important cause, hypertension. If anybody is uncontrolled hypertension for a long time, they chance to develop kidney problem. Some medication we already finished here. So medication list here, some antibiotics like amphotericin B. This is actually antifungal medication, or rifampin, anti-TB, sulfonamide, tetracycline antibiotics, vancomycin, gentamicin. They are nephrotoxic. Aminoglycoside, right? Gentamicin, kanamycin, neomycin, tobramycin, all are nephrotoxic. If your patient do not have any other choice, they have to take the aminoglycoside. So what you should do, before start the medication, we can check the kidney function. And after starting, we also will check the kidney function to check how kidney works. Other medication like acetaminophen or cyclosporin, is that cyclosporin immunocompromised patients causes the immunocompromise of the bone marrow, or malarial drugs, quinine, right? Some chemical substance like carbon tetrachloride or organic solvent, also chemical substance bad for your kidneys. What are the other medication can cause the kidney problem? Like antineoplastic, means the medication we use for the cancer treatment, like cisplatin, or cyclophosphamide methotrexate can cause kidney problem. Or some non-steroidal anti-inflammatory, shortly called NSAID, like celecoxib, ibuprofen, indomethacin, ketorolac, right, naproxen, all of them causes your kidney problem if you take for a long time. So other non-pharmacological chemical substance like radiographic contrast dye. So it is actually diagnostic procedure. Sometimes we use the radiographic contrast dye. If kidney does not work well, this material not to allow to excrete from the body, and they deposit and causes the damage. Also some pesticide or fungicide or myoglobin can cause. Some heavy metal like arsenic, bismuth, gold, copper can cause your kidney damage. There are two important notes every student should know. One is, if the patient is diagnosed the disease and treatment option only this medication which is not too good for the kidney, in that scenario we could check the kidney function. If kidney function is okay, we give them medication, and after started this medication, after a certain interval, every 2 weeks or every month, we can check the serum creatinine level and BUN level and check the kidney is okay or not. So here, this is another important cause of kidney damage. This is polycystic kidney disease. It is a genetic disorder. Or even urolithiasis, means the stone formation inside the kidney. Or even pyelonephritis, right? They can cause the kidney problem as well. So now we are going to focus on acute kidney injuries. Acute. So there are two terminology. One is the acute kidney, other is called chronic kidney problem, right? So acute kidney problem, basically the sudden loss of kidney function, right? And chronic kidney injury, gradually loss of kidney function. Okay, so here, and also acute kidney injury is a rapid loss of kidney function from renal damage. This occur abruptly, means sudden. But acute and chronic, I said difference. Chronic kidney gradually lost the kidney function. Acute case, if treated very well, appropriate medication, good care, the function is reversible. So the acute kidney problem is a reversible problem, right? So if sudden loss of kidney function or sudden loss of glomerular function to excrete the toxic and regulate the fluid and electrolyte, it is occur in acute kidney problem. So everybody know that the major function of the kidney to expel out the waste product from the body. If my kidney does not work, then waste product build up. Waste product means creatinine or BUN. Creatinine is formation because of muscle breakdown, and BUN, blood urine nitrogen, is produced because of protein metabolism. When kidney does not work, the electrolyte imbalance occur, right? AKI leads to the cell hypoperfusion or cell death, right? Or they said the decompensation of the renal function. Prognosis depends on the contribution of the client or patient body condition. Here is a normal or abnormal kidney function may resume gradually in case of acute kidney problem, right? So what I'm saying that it is sudden but reversible. Okay, so here in this PowerPoint showing some important causes of kidney problem like heart failure. So heart failure or CCF, congestive heart failure, or myocardial infarction, when heart muscle is weak, does not work well, cardiac output less. When cardiac output less, the kidney tissue perfusion go down, right? Perfusion to the kidneys go down. So because kidney work as a filter, blood is passing inside the kidney and body, waste materials is excreted and good materials is reabsorbed. But if kidney output is, cardiac output is go down, less perfusion to the kidney and causes a problem. Another big issue to produce the kidney problem, they are nephrotoxic drugs. The drug list we finished a few minutes ago. So this is another cause. Another important cause of the kidney problem are infection, right? infection lead to the inflammation as well. Or if our body has any problem like autoimmune disease, inflammation is occur to own tissue without any external source, like vasculitis, they can cause the kidney problem as well, right? Also, if the low blood volume, like dehydration because of vomiting, dehydration because of diarrhea, or if your body do not get enough fluid, dehydration lead to the hypovolemia, less blood supply to the kidney, and causes the acute kidney problem, right? So here we go. So there are four important causes. They causes the acute renal failure, right? In second page here, cause the acute kidney injury, the causes. What are the most important causes of the kidney problem here? So the causes of kidney problem we categorized, or type of kidney problem we categorized by three. One is called pre-renal, intra-renal, and post-renal. The picture you can see, this is the heart, this is the kidney, ureter, urinary bladder, and urethra. So pre-renal cause means that any kidney problem before to kidney level, or from kidney towards the heart, any problem in between kidney towards the heart. This is called pre-renal AKI. So pre-renal AKI may be because of the dehydration or because of shock. So dehydration or shock decrease the blood flow to the kidney. So due to decrease the blood flow to the kidney, and kidney does not work. What are the pre-renal cause? Maybe dehydration because of diarrhea or vomiting, or shock, any sepsis, hypovolemia, or renal vascular obstruction before the kidney. So here, shock is the one of the important cause. Circulating volume depletion, right? Decrease the cardiac output. So if patient have MI or congestive heart failure, cardiac output go down, perfusion go down. Decrease the peripheral vascular resistance or renal artery obstruction. So this is the aorta. There are two branches pass through the kidney and they supply blood to the kidney, right? If any obstruction in this level, they also pre-renal cause. Let me read it. So the cause outside the kidney, or the cause from kidney towards the heart, and they causes the volume depletion, dehydration, decreased cardiac output, decreased peripheral resistance, right? The second cause are intrarenal, means the problem inside the kidney. So this is the kidney you can see, right? And kidney made by thousand nephron. If your nephron does not work, or any tubular damage inside the kidney or any chronic kidney structural problem like glomerulonephritis. This can cause the kidney problem. Let me read it, my friend. Within the parenchyma of the kidney, the anatomy or histological structure of the kidney is called parenchymal tissue. Causes by tubular necrosis, prolonged pre-renal ischemia, or intrarenal infection or obstruction or any nephrotoxicity. So chronic infection inside the kidney tissue or chronic obstruction inside the kidney tissue, or if the parenchymal structure damage, they causes intrarenal acute kidney problem. Out of all, the most dangerous one, most important one are called glomerulonephritis. Or any glomerulonephritis is occur because of infection, streptococcal infection, or even some autoimmune disease like lupus, chronic hypertension, uncontrolled diabetes, all causes the parenchymal damage of the kidney, and they lead to the kidney shutdown. What wrote here, let me share with you. Acute tubular necrosis, renal trauma, severe muscle excretion, genetic condition, infection, glomerulonephritis, renal artery lesion. The last course here is called post-renal. So any problem below the kidney towards the urethra. So imagine any stone formation in the ureter and the urine does not passing from kidney towards the bladder. Obstruction in the ureter or obstruction in the urinary bladder, when urine does not clear out, they causes hydronephrotic change in the kidney. Long-term hydronephrotic change can cause the kidney shutdown, and this is called the post-renal cause. The other problem is benign enlargement of prostate, right? So, or any obstruction in the urethra, or any stone formation in the urinary bladder, or any trauma is difficulty to output, and they cause kidney problem. So post-renal cause due to the obstruction to leaving the kidney. Why obstruction? Because of stone, tumor, or benign prostate hyperplasia. So let me read it. Between the kidney and urethral meatus, such as the bladder neck obstruction, bladder cancer, calculi means stone, or post-renal infection. Here in the picture, they're showing prostate disease, because prostate is there. When prostate hyperplasia, they stop the urine outflow. And here, pelvic urethra, another cause, pelvic trauma. So in the same picture, I want to review with you. So you see, this is the aorta and vena cava behind, and this is a renal artery. If any problem in this level, obstruction occur in the renal artery, it is called pre-renal cause. If any problem inside the kidney because of structural problem, parenchymal problem, infection inside, glomerulonephritis, and kidney shutdown, is called intrarenal problem. Maybe some toxic drugs, inflammation can cause and reduce the blood supply. If the problem in the urethra or in the bladder or in prostate or obstruction in urethra is called post-renal, right? So because of our profession, it is very important to take care of this patient. Okay. So now here we are going to discuss about the phases of acute kidney problem. So the acute kidney phases we categorized in 3 phases, or onset of the kidney problem we categorize in 3. One is called oligouric phase, oligouric. Second one is called diuretic, and third one is recovery phase. So onset to development of oliguria, sometimes it takes hours to days, right? So oligouric phase, what change occur inside the kidneys? So I said urine output basically, I mean, is 100 to 40 ml 24 hour. Okay, so the normal healthy kidney excrete 1 to 2 liter per day, but oligouric phase, if the urine does not produce enough amount. For some client, oliguria does not occur and urine output is normal. However, the duration of oliguria is 8 to 15 days, even longer duration. So sudden decrease the urine output is less than 400. Some books say urine output is 100 to 400 per 24 hours. So oliguria means scanty amount of urine produced, the sign of excess fluid volume sometimes, like hypertension, edema, or pleural or pericardial infusion, dysarrhythmias, heart failure, or pulmonary edema, right? If our kidney does not work well, and body build up creatinine or BUN, electrolyte imbalance, all of them can cause severe problem, and they produce the sign of uremia. What are the sign of uremia? Anorexia, nausea, vomiting, and pruritus. Why pruritus? When body does not work, kidney does not work well, does not create it, expel out the crystal creatinine, they accumulate in your skin, because skin also excreting the substance, very little amount. But if kidney does not work, they try to expel through the kidney, they deposit inside kidney and causes pruritus, itching. Sign of metabolic acidosis. If the acute kidney failure, the respiration is rapid and deep. This is called Kussmaul respiration. In case of diabetic ketoacidosis, also patient have Kussmaul respiration. The sign of neurological change like tingling extremities or downness, right? Disorientation or coma. So oligouric phase, what are the other signs and symptoms? Patient develop the pericarditis event, or laboratory studies with the early recognition or potential of AKI, the client may be treated with fluid like IV fluid, or fluid intake may be restricted. Assist the admin medication as prescribed, such as diuretics. So, my friend, in case of AKI, there's some restriction about potassium, phosphorus, and magnesium intake. Also, we have to follow the healthcare provider guideline about the protein intake, about the fluid intake, right? So here, so next phase is called diuretic phase, right? Diuretic phase means the excess amount urine produce. So diuretic phase means start the kidney to recover. And also the large amount of urine produced excrete or 2 to 6 weeks is the diuretic phase. We said acute kidney injury has a 3 phases: oligouric, when the urine produce go down; diuretics, when the kidney start to urine production, a large amount of urine excreted; and finally recovery phase, when the kidney reback the function well. So now let me see you read it. Excess urine output indicate that damaged nephron are recovering their ability to excrete the waste product. In the diuretic phase, dehydration, hypovolemia, hypotension, and tachycardia may occur. If you compare and contrast with oligouric phase, in oligouric phase, urine production go down, means low urine output, less than 400. Patient develop hyperkalemia, hypertension, or elevated the BUN, blood urea nitrogen, or creatinine level, and also fluid overload. Make a short note. I said in oligouric phase, potassium level go up, high blood pressure, BUN or creatinine level go up, right? Next here, recovery phase, the last phase in acute kidney injuries. Recovery phase, I said. In that stage, kidney tissue is almost normal, and this phase continue until complete recovery. Sometimes take 1 year. Recovery is very slow. Urine volume return to normal, memory improve, strength increase, and also AKI can progress if the acute kidney does not treat well. They lead to chronic kidney problem. My friend, because of our nursing profession, it is important to take care of our patient. Definitely, we have to follow everything as prescribed, but it is important to share with you. Restricted the potassium, restricted phosphorus or magnesium intake is very important. Also, increase the protein intake. But some books said how much protein intake or restricted, it depends upon the patient condition, kidney function condition, even patient age, right? And some book mention we have to reduce the sodium intake, we have to reduce the calcium intake. The most important point here is a RN or LPN. Our nursing intervention, we could measure daily body weight. It indicates patient has any retention of fluid or not, edema develop or not. Also restrict the urine output and urine input, right? So the sign and symptom of the acute kidney injury are caused primarily by retention of nitrogen waste product or retention of the fluid and inability of the kidney to regulate the electrolyte. Very important. Now here's some laboratory analysis in case of the acute renal failure, laboratory analysis. So already you know that in AKI, chronic kidney or acute kidney injury, that we have to check the BUN level and creatinine level. And also we have to check the glomerular filtration rate, right, my friend? So BUN is called blood urea nitrogen. They elevated. Basically, the BUN level is 10 to 20 milligram per DL. They are 10 to, like I said, I could write it. It is 10 to 20 milligram per DL. This is the BUN level. BUN level. So if BU level is elevated, may indicate kidney disease or kidney dysfunction or dehydration. Another one is called specific gravity, urine specific gravity, and this also reduce, right? So specific gravity should be basically in between 1.01 to 1.03. Okay, it is just normal specific gravity, but specific gravity reduce. In the normal healthy kidney, if you analyze the kidney, you analyze the urine, usually no glucose, no protein, no ketone body, no leukocyte found, right? But if the kidney problem, acute or chronic kidney, or if patient is diabetic, we can get the in urine glucose positive, protein positive, ketone body positive, or leukocyte estate positive, or nitrate should be found in urine, right? The other one is called creatinine, another marker. So creatinine, the normal range of creatinine is 0.6 to 1.2 milligram per DL, right? So if the kidney does not work well, the creatinine build up in the body, and they causes the problem. So elevated level indicate kidney disease, right? Like as BUN. What others? Also hyperkalemia, hypervolemia, but hypocalcemia and hyperphosphatemias. So I said potassium or phosphorus, magnesium, they go up, right? But sodium plus calcium supposed to go down, and calcium go down. Sodium and calcium go down. So this is basic about the laboratory studies. What next? In diuretic phase, gradually decline BUN and serum creatinine level. Maybe they're going to get normal. Also hypokalemia, hyponatremia, hypovolemia, and continue low creatinine clearance with improve the GFR. Recovery phase, the increase the GFR and stabilize to continue decline BUN, and complete recovery may takes 1 to 2 years. So now going to focus here about the GFR. So GFR, this is actually glomerular filtration rate. So means how, total amount of blood or blood flow through the urine per minute. How much blood going through per minute through the kidney. Normal GFR is from 90 ml per minute, and somebody it is 100% or 120 ml per minute, right? This is a normal GFR. So they said GFR is supposed to be normal, indicate the kidney is completely recover phase here. So next here, the some intervention about the AKI. What we will be do, always check the vital sign, right? So vital sign indicate your patient is stable or unstable, and also strictly maintain input and output chart. Our most important work, measurement daily body weight, right? Use same scale, same cloth, same time of the day. So if we see it is changing, indicate body does not excrete the urine and fluid accumulate inside, and it is indicate the retention and also develop the edema. We check regular BUN level, creatinine level, and check the electrolyte. Another question is important. Sometime NCLEX board asks, what are the best diet for the client with acute renal failure? Answer is the high carbohydrate and low protein. So in this picture, you can see acute kidney injury can lead to, if anybody diagnosed acute kidney injuries, and if it is untreated or maltreated, inadequate treatment, and they lead to develop the chronic kidney disease, the chance to develop impaired innate immunity, and in future parenchymal disease or glomerulonephritis. They causes imbalance of electrolyte or acid-base imbalance occur. Also, fluid overload. Patient develop the peripheral edema. So another complication, if AKI, they develop acidosis may occur, right? acidosis may occur. So here, sometimes NCLEX would ask this question about AKI. I mean, what are the imbalance occur? We said acidosis. Monitor the urine for the protein level, hematuria, karst, or specific gravity, right? So high carbohydrate is our diet choice, but low protein. Monitor the altered level of consciousness. Why? When BUN accumulate in the body, not expel out, they deposit in the brain tissue and impair the brain function, and patient develop confusion. Also, confusion occur because of uremia, and uremia occur because of this. Monitor the lung function because of fluid accumulate, indicate the overload of fluid, right? And again, we admin diet as prescribed. So I said low protein or molecular, low restricted protein, but high carbs is the best food for them. So what else? What next? Next here, restrict the potassium and sodium intake, adjust to admin medication as prescribed. Also, check the nephrotoxic medication. If anything, we have to notify it to the healthcare provider. So if any medication is, we see the dose is not accurate, we have to hold it. And finally, if patient condition is not improved, we go for dialysis. There are two types of dialysis, peritoneal dialysis and hemodialysis. We have one lecture on dialysis. I will discuss everything up there. Now also, what the next patient need emotional support, right? And in their services, it is better to encouraging the family member to interact. And also, we have to promote the consistency in caregiver. Next, we are going to go in chronic kidney disease. We are going to continuation of chronic kidney disease. So chronic kidney disease, before to go, I want to share a small picture here. This is the kidney. You can see we have two kidneys, and every kidney functional component are called nephron. Every kidney, more than 1 million nephron. Nephron is the structural unit. So inside the kidney, you can see the artery go inside and venous system go out. This area is called renal pelvis up to the lower pole of kidney. Then it is ureter. So the blood go or enter through this artery, distribute the blood after filtration. So the waste product excreted or make the urine, and reabsorb product go back through the venous system. This one is called pyramid. The space between two pyramids is called column. Outer layer is the cortex and inner layer is medulla. So chronic kidney disease, basically the parenchymal damage occur. Inside the structural damage occur. if the underlying cause is autoimmune, they produce the immune complex and resulting inflammation of the glomerular capillaries. In this picture showing glomerulus, outer layer is called Bowman's capsule. In one glomerulus, artery go and inside afferent and came out called efferent, right? And filtrate blood get out from glomeruli. So chronic kidney disease most of the times attack to the glomerulus, and glomerulus lost its own filtration power. So chronic kidney disease here is shortly called CKD. It is slow, progressive, irreversible loss of the function of the kidney. So you see that they are gradual, they're slow, but progressive. Means glomerular filtration rate is go down by time. And if damage occur, it is not possible to recover, not reversible. And we use it is irreversible. So here I want to print something in your brain. CKD is a gradually damage to the kidney, whereas the acute kidney or AKI is a sudden onset. AKI is a reversible, but CKD irreversible. Loss of kidney function. The GFR less than or equal 60 ml minute for 3 months or longer. So GFR stands for glomerular filtration rate. How much blood passing through the kidney per minute, right? So in this picture, you can see the normal healthy kidney, but chronic kidney disease by time gradually lost their function, and also size is going smaller to smaller. The occur in the states with loss of 75% function of nephron. When the nephron lost 75% function, we call end-stage renal disease, and eventually result in uremia or end-stage renal failure. Hypervolemia, there are so many underlying causes of chronic kidney disease, right? We're coming them few minutes later. Hypervolemia can occur because of kidney inability to excrete sodium and water, or hypovolemia can occur because of kidney unable to conserve sodium and water. There's some physiological change occur inside the body in chronic kidney failure. So there's some primary causes of chronic kidney disease. Here some of the causes wrote here, but I want to share with you the 4 major causes of kidney failure, especially the chronic kidney problem. One of the most important cause of kidney failure, diabetes mellitus. But diabetes must be uncontrolled. So uncontrolled diabetes mellitus, one of the important cause of kidney failure. So because diabetes also alter the metabolism function, it is the metabolic disorder. Second most important cause of chronic kidney disease is hypertension, uncontrolled hypertension, malignant hypertension for a long time. They can also causes the chronic kidney problem. So diabetes one cause, second cause hypertension, right? Another cause of kidney problem, chronic kidney, is called parenchymal kidney problem. Structural problem, it is called glomerulonephritis, GN, right? Glomerulonephritis. So glomerulonephritis are the structural or parenchymal disease. Sometimes glomerulonephritis can cause autoimmune disorder. In autoimmune disorder or glomerulonephritis or even lupus nephritis, the immune complex produce or immune complex disease result in inflammation of glomerular capillaries. If anybody's kidney is repeatedly exposed to infection, repeatedly or recurrent infections with no UTI, they can repeatedly inflammation of the kidney structure, especially staphylococcal infection can cause this problem, and they lead to the chronic kidney disease. Other most important cause of the chronic kidney problem, if anybody's acute kidney disease is not treated well. So acute kidney or AKI, if not treated, maltreated, repeatedly occur, they also lead to the chronic kidney disease, right? This is the risk factor of the chronic kidney disease. If you read some book, some journal very agree with you, the aging is an important factor of the chronic kidney disease, dehydration, or some medication like gentamicin, NSAID, right, also can cause renal problem or chronic disease problem. What are the data collection or sign and symptom of the chronic kidney problem? So monitor the body system for manifestation of CKD. Chronic kidney disease affect all major body system. All major means your heart, musculoskeletal, your respiratory, and sometimes patient need, most of the times, patient need kidney dialysis or kidney transplant to maintain the standard life. Also monitor the psychological change, which cause include emotional instability, withdrawal. Patient sometimes think about suicide because of depression or anxiety develop. So they need your mental support. When you plan for the care, better to motivate them, involve the family member, right? Also, chronic kidney disease causes the change the body image. Very important. So here we are going to categorize the chronic kidney disease, there are some stages, 5 stages, right? So stage 1, 2, 3, 4, and 5. So these stages we done according to the glomerular filtration rate values. If the creatinine or BUN level is impaired or increased, then we go to check the GFR to categorize what the stage of CKD. If the GFR is less than 90, right, ml per minute, it is called stage 1. So in the stage 1, normal or increase the GFR with other evidence of kidney damage. Maybe BUN level impaired, increase, creatinine level increase. In renal biopsy, we can change some parenchymal damage, but GFR is less than 90, right? It is stage 1. The stage 2, the GFR is 60 to 89, right? Description, the slightly decrease the GFR with other evidence of kidney damage. The stage 3, the GFR is supposed to be 90 to 59. Some book divided stage 3A and stage 3B, right? But stage 3 basically GFR 30 to 59, and moderately decrease the GFR with or without other evidence of kidney damage. And next here, the stage 4, GFR is 15 to 29 per minute, ml per minute, and severely decrease in GFR with or without other evidence of kidney damage. The stage 5, GFR is less than 15 ml per minute. It is the stage 5, or we call end-stage renal failure, when GFR is less than 15 ml per minute, right? Is the stages of CKD. In this picture, you can see the sign and symptom of chronic kidney problem, or we said the manifestation of kidney problem here. So as we know, the chronic kidney disease get involved almost all system in our body, right? So as like the respiratory system, I'm just going to focus few of them here. Like respiratory system can cause the like ataxia, alter the gait, lethargy, paresthesia. We are respiratory systems we are talking about. So when CKD is occur and kidney does not excrete well to the fluid from the body and fluid accumulate, they causes edema or congestion in the lungs. So patient complain the shortness of breath or crackles and deep and depress the cough reflex, shortness of breath, trachypnea, cosmal respiration, pleural effusion, pulmonary edema, right? So this is the sign in respiratory system. What about the hematological? Hematological system causes abnormal bleeding, bruising, anemia developed, right? Because kidney produce erythropoietin. Erythropoietin help to formation red blood cell. If there are kidney does not work, no erythropoietin and develop the anemia. If you do not correct the anemia, patient heart failure arise, feeling tired easily. So intragumentary system, you see, decrease the skin trigger, dry skin, ecchymosis, pruritus, and uremic frost. In this picture, you can see the uremic frost. In this picture, you see the outline, white crystal. So what it is? It is called uremic frost. Okay. This is actually the urea crystal that come through the skin with perspiration. Because kidney does not work and waste product try to eliminate from the body, and crystal is trying through the skin and they accumulate in the outer layer. So if I ask you, where would you see the uremic frost? Usually face, underarms, groin, or below the hair follicle. So it is very important, educate your patient or client your patient to wash the skin with the plain water. So it is the nursing intervention. So what about the musculoskeletal? Bone pain, because electrolyte imbalance, muscle weakness, pathological fracture. In this radiography, you can see the fracture of the humerus, neck fracture, right? Reproductive system, decrease fertilities, libido, or impotency. Next here, neurological. Patient develop ataxia, alter the gait. They develop lethargy or seizure, difficult of speech, or tremor, twitching, and jerky movement. Gastrointestinal, anorexia, nausea, vomiting, constipation, diarrhea, metallic taste, uremic colitis, cardiovascular, hypertension. If kidney does not work, then imbalance of ADH, imbalance of sodium and water balance, they lead to hypertension, heart failure, edema because fluid overload, cardiomyopathy, effusion, right? And also some urinary manifestation like polyuria or nocturia at early stage, or proteinuria. Protein, usually healthy individual, there are no protein in urine. But when kidney does not work, then protein, especially albumin, present in urine. And urine color straw appearance or hematuria means urine mixed with blood. So if I make a summary out of the sign and symptom in CKD, we can see decrease the urine output, or patient develop hypertension, decrease urine specific gravity, and fluid overload. Because of fluid overload, patient develop shortness of breath, patient develop effusion or edema. So what are the intervention? So we modification the patient diet, give them diuretics or antihypertensive medication, monitor BUN and creatinine level, and most important, to measurement daily body weight to check the fluid retention or not. Sooner or later, the chronic kidney problem patient need the dialysis. What next? Next is here the CKD or chronic kidney disease. In this picture, you can see in a short the chronic kidney disease, some major underlying cause: diabetic, high blood pressure, right? Heart problem, obesity, positive family history, chain smoker, tobacco smoker, also aging. So aging is one of the risk factor to develop chronic kidney disease. Hypertension is one of the important cause. Frequent infection is one of the cause. Uncontrolled diabetes, another major culprit, or renal or urinary obstruction. So the progress of chronic kidney disease here should increase when the patient have underlying risk factor. They increase the risks to develop the kidney damage and reduce the renal function or GFR, and they lead to kidney failure, or they lead to chronic kidney problem. What next? Next is here the intervention or laboratory study or nursing intervention is super important here. So, and also the dietary restriction or advice. So admin the prescribed diet, which is usually moderate protein and high carbs and low potassium and low phosphorus diet. So if I ask you what are the best diet for CKD, you can answer me high carbs or high carbohydrate and low protein or restricted protein. It depends upon the stage of the kidney, it depends upon the patient body condition and age. So the goal of this diet is to provide the energy while decrease the protein metabolism. And also we give them low potassium and low phosphorus diet. Right? So provide the oral care to prevent the stomatitis and reduce the discomfort from mouth sore. Provide skin care to prevent the pruritus. Why pruritus? Because urea crystal accumulate in the skin with perspiration. They can cause pruritus. and teach the client about the fluid and dietary restriction and improve the daily measurement of daily body weight, indicate the edema or retention of urine, retention of fluid. And I said the final choice for chronic kidney disease is a dialysis. There are hemodialysis and peritoneal dialysis. And also, if kidney can manage, the kidney transplantation are the other option. And also, we provide the information that the kidney function is declining and the time may reach to the end stage renal disease and require the dialysis, encouraging the healthy lifestyle, right, to the patient. Now, here going to talk about the specific management of the kidney problem, right? Let me recap something to go to the specific management. In case of CKD, we can see the elevated creatinine and BUN and decrease the sodium and calcium, decrease, but increase the potassium and phosphorus and magnesium. So if the potassium and phosphorus and magnesium increase, we give them low potassium, low phosphorus diet. In case of CKD, decrease the sodium and calcium. So we will give them food contain a good source of calcium and sodium, right? Also, we have to check regularly hemoglobin and hematocrit for anemia, because anemia is a major problem in case of CKD. We could urinalysis to check the hematuria or proteinuria. Hematuria and proteinuria also common problem in chronic kidney disease. Okay. So let me read it. They said the specific problem in kidney disease and intervention, activity, intolerance, and insomnia. This is also the problem for the patient, insomnia, easily fatigue because of anemia, red blood cell go down because of erythropoietin. The function of red blood cell carry the oxygen to the tissue. Oxygen causes the metabolism in the body and produce the energy. But when anemia, less hemoglobin, less oxygen delivered to the body, less metabolic reaction, less ATP produced, and you easily get tired, you easily get fatigue and interact your bodily activities. So educate your patient, provide adequate rest, and teach your client to plan the activities to avoid the tiredness or fatigue, right? About the anemia, let me read. Anemia result from decrease the secretion of erythropoietin by damage the nephron, resulting in decrease the production of red blood cell, monitored to reduce hemoglobin and hematocrit level. We have to admin hematopoietic substance like apotin alpha. Apotin alpha is increase the hemopoietic system. They help to produce red blood cell and prevent anemia. Also, it is good to give them folic acid and iron. This is the most important component of the maturation of RBC, or iron is the component of hemoglobin. They easily bind with oxygen and carry the oxygen to the tissue. Assist to admin the stool softener because of constipation effect of iron. So there's some note for you. Note that oral iron is not well absorbed by the gastrointestinal tract in chronic kidney disease and causes the nausea and vomiting. Parental iron may be used if the iron deficiency persists because of folic acid or oral iron administration. So your patient need folic acid for red blood cell maturation. Your patient need iron for hemoglobin formation. Both of them prevent anemia, right? Here they said the assist to admin blood transfusion. If anemia still persists, not corrected, we give them some blood transfusion, right? So it is very important just monitoring the medication what your patient are taking during the CKD treatment. Even some patients need digoxin for heart problem or sodium polystyrate. Why sodium polystyrate? To reduce the serum potassium or erythropoietin to increase the red blood cell formation. Erythropoietin, why? Because kidney does not work and kidney produce the erythropoietin. So if kidney does not produce erythropoietin, we give them erythropoietin to increase the red blood cell. Some healthcare provider prescribe diuretics like furosemide, and it is also important educate your patient to avoid non-steroidal anti-inflammatory medication or contrast dry. Also, magnesium containing antacid. In case of CKD, patient easily develop gastrointestinal bleeding. So urea is broken down by intestinal bacteria and they produce ammonia, NH4. And ammonia irritate the gastrointestinal mucosa and causes bleeding. We could monitor the decreasing hemoglobin and hematocrit level, right? Decreasing hemoglobin and hematocrit indicate anemia, right? Also, we could monitor the stool. So monitor the stool for occult blood. Avoid admin acetyl salicylic acid or NSAID. Is bad for your kidney. What next? In case of CKD, the patient develop imbalance of electrolyte, especially decrease sodium and calcium or increase the potassium, phosphorus, and magnesium. So we have to have some ideas how to deal with increased potassium, and it's called hyperkalemia management. Then we could know how to management hypermagnesemia. We have to know how to management of hyperphosphatemia, right? And also hypertension, hypervolemia, and I said decrease the sodium and decrease the calcium. We have to know how to maintain hypocalcemia, right? And also here let me go back a little bit. Here, first one is hyperkalemia. Now we are going to talk about how to management of hyperkalemia or hypermagnesemia or hyperphosphatemia in case of CKD, right? So monitor the vital sign for hypertension or hypotension. Monitor the serum phosphorus level. My friend, why we are going to talk about the management of hyperkalemia? Why not hypokalemia? Because CKD patient develop hyperkalemia because increase the potassium level, right? Monitor serum potassium. Elevated serum potassium level can cause decrease the cardiac output, heart block, fibrillation, or asystole. So we give them food that contain low potassium diet. Avoid the food that contain high potassium. Also, assist the admin of electrolyte bindings and excretion medications such as oral or rectal sodium polystyrate sulfate. What is that? Sodium polystyrate are the substance that bind the excess potassium and reduce the potassium level, and also assist to admin prescribed medication, right? 50% dextrose and insulin because they reduce the potassium as well. Calcium gluconate also is important, good choice to reduce the potassium. What next? Here showing some electrical change in EKG because of hyperkalemia. So in this EKG, we can see the EKG hyperkalemia where we can found the peaked T wave and wide QRS complex on EKG. So you see the QRS complex is wider and peaked the T wave. T wave is peaked. In here showing the potassium level, it is more than the normal, and when it is 7, this change occur. When it is 8 to 9, more T wave and QRS complex, right? So next here, hyperkalemia management. As a RN or LPN, we closely monitoring the EKG or cardiac status on EKG that we saw before, admin diuretics and other medications such as glucose and insulin. Here we give them insulin and glucose. Hold the potassium supplement and potassium sparing diuretics. Monitor the serum potassium level very carefully and teach the patient to avoid the food high in potassium and salt substitute, hyperkalemia. And finally, if not possible to manage, go for dialysis, either peritoneal dialysis or hemodialysis. Here, we have one lecture on peritoneal or hemodialysis. You can listen them as well. Place the client with a kidney disease to continue cardiac monitoring. Now go next one, hypermagnesemia. Again, I said why we're going to talk to management of hypermagnesemia. Why not hypomagnesemia? Let me recap it. In case of CKD, in lab study, we can see increase the potassium, increase the phosphorus, increase the magnesium. So hypermagnesemia is important to manage. Result from decrease the renal excretion in magnesium, monitor the cardiac manifestation of the bradycardia and peripheral vasodilation. What are the other hypermagnesemia problem, right? So when magnesium going up, your brain function will be altered. It's called the monitor the central nervous system work, monitor neuromuscular function, assist to admin loop diuretics, assist admin calcium, avoid medication that contain magnesium as well. So neuromuscular depression is common, cardiac muscle depression common, weakness, nausea, vomiting, central nervous system depression, lethargy, and bradycardia. So what next? We tell your patient to avoid magnesium rich food. This is the food list. They contain too much magnesium. So our first priority, initiate the safety precursor for hyperkalemia or hypermagnesium management patient. We have to monitor blood pressure, pulses, respiratory rate closely, admin the calcium gluconate. Also teach the patient renal disorder and avoid the food containing high magnesium. This is the food list. Hyperphosphatemia also, as phosphorus level when raise up, calcium level drop. So patient who develop the hyperphosphatemia, they have a chance to develop hypocalcemia, right? This is the opposite. So calcium level go drop, and this lead to stimulation of parathyroid hormone. So we know the CKD is a multi-organ system problem. You see, phosphorus level go up, calcium level go down, and parathyroid gland is stimulated. And they cause bone demineralization because calcium is an important component of bone. Treatment aimed at lower the serum phosphorus level. When serum phosphorus level go down, calcium level will go up. Assist to admin phosphate binder, right? Admin the stool softener, reinforce the teach the client about the need to limit intake of food that contain high phosphorus. This is the food list we could see. They contain high phosphorus like meat, fast food, cheese, milk, cola, and some seed and fish. Better to take less. Hypertension management or hypervolemia management is another challenging for CKD patient. Hypertension causes by failure of the kidney and maintain the blood pressure hemostasis. Monitor vital sign for elevated blood pressure. Maintain the fluid and sodium restriction as prescribed. Admin diuretics or antihypertensive to control hypertension. So if your kidney does not work well, also impaired ADH function, impaired sodium and water balance, and they lead to hypertension. Hypervolemia, monitor the vital sign and elevated blood pressure. Monitor intake and output, so strictly maintain import-output chart. Monitor for periorbital, sacral, or peripheral edema, because CKD patient retention of fluid. Always we could monitor the serum electrolyte level, right? So again, I want to recap it. When you go in serum electrolyte level, we can see the potassium, the phosphorus, and magnesium. These three always go up, whereas the sodium and calcium, these two go down, right? Very important in CKD. So next here, hypervolemia. Monitor the hypertension, monitor the sign of heart failure. Also check the lung function test. If we get the crackles, we always notify healthcare provider. Maintain fluid restriction. Avoid admin large amount of IV fluid. Assist the admin diuretics. Teach your patient to maintain low sodium diet, and teach the client avoid over-the-counter medication. Hypocalcemia, another problem, right? Result from high phosphorus level, and high phosphorus level lead to low phosphorus, low calcium, and when calcium is low, imbalance, they interfere with the vitamin D, inability to decrease the kidney to activate the vitamin D. Absence of vitamin D causes the poor calcium absorption from intestine. Monitor serum calcium level. Admin calcium supplement. Admin activated vitamin D is prescribed. So let me recap something. If your patient has a hypokalemia because of hyperphosphatemia, we closely monitor our patient, monitor for respiratory and cardiac status. Initiate the safety precursor to protect the confused client. Admin oral or parenteral calcium supplement. Also, during the IV administration, closely monitor for cardiac status and EKG, right? Next here, hypovolemia. Monitor the vital sign for hypotension and tachycardia. When your patient has a hypotension, they always tachycardia. When patient has a hypertension, they have a bradycardia. Monitor for decrease the intake and output chart and reduce daily weight. Monitor dehydration and electrolyte level. Also, assist to admin replacement therapy based on serum electrolyte levels. So the next one here, we are going to discuss the infection control in case of CKD. So infection is also most common in case of CKD. What it is? The client at the risk for infection caused by suppressed the immune system, dialysis excess site, and possible malnutrition. So when patient go for CKD or under the process of dialysis, even kidney transplant, the immune system is suppressed, so infection easily catch up. So always you could keep open your eye to check the sign and symptom of infection. Like the most common sign of infection, patient complain of fever, increase the body temperature. CKD patient or transplant or dialysis patient most of the times use the urinary catheter, and catheter also the important cause of infection. If it is untreated, all develop asepsis. If you not cure the asepsis, they develop to septicemia, and septicemia lead to the shock and patient die. Educate, instruct to the client to avoid fatigue. Educate the client to instruct to avoid person contact, public place, better to avoid. Assist the administration of antibiotic to prevent infection. Also avoid nephrotoxic medication. So in case of CKD, what kind of metabolic change occur? It is called metabolic acidosis. So kidney are unable to excrete the hydrogen ion or manufacture of bicarbonate, result in acidosis, because hydrogen and bicarbonate is an acidic substance. Assist the admin of alkaline, so it would be balanced, right? Notify that the client with CKD adjust with low bicarbonate level and do not become acutely ill. The muscle cramping is another problem of CKD patient or chronic kidney problem. So about the muscle cramping, what we should do? Occur from electrolyte imbalance and affect the uremia. Monitor the serum electrolyte, assist admin electrolyte replacement, admin for heat or massage as prescribed. How to deal with the neurological problem? So the buildup of active particles or fluid causes change in the brain cell, which is lead to the confusion and impaired in decision-making ability. Cognitive function will be impaired. Peripheral neuropathy turns to develop. Why? Result of effect of uremia. Why uremia? Because nitrogen substances accumulate, right? they impaired brain function, patient confused, right? Monitor for the confusion consciousness. Monitor the restless leg syndrome, which is a common in also dialysis treatment. Reinforce or teaching the client to examine the area, decrease the sensation or the sign of injuries. So another problem, the patient who have a CKD, it is pruritus. So pruritus occur because of the crystal accumulate under the skin. So to ride the body to excess waste or urate crystal that excrete through the skin during perspiration, that is causes pruritus. It is very important educate your patient to wash the skin through the clean water and avoid to use the soap. Very important. The deposit of the urate crystal, which is called uremic frost, occur in advanced CKD. Monitor the skin breakdown. So because of the crystal accumulate, the skin is easily break down, causes ulcer formation. Provide meticulous skin care. It is very important. Assist the admin antihistamine for pruritus or itching. Reinforce the teaching for the client to keep the nail trimmed, right? Otherwise, chance of the infection spread out. Finally, we need some psychological or good counseling for your patient, right? A CKD patient is unlucky patient, right? So organ stage, end organ stage failure. Listen the client concerned to determine how the client is heading. Allow the client time or to verbalize their emotion. Educate the client about the treatment option. You can explain them advantage or disadvantage of dialysis or option for the kidney transplant. Choice by themselves which one they prefer. So elderly client with CKD may progress slowly towards the end stage renal disease or require dialysis. The client may decline or no treatment. So it is totally patient choice if it is their right, right? So inform the supporting group is also important. And this is very important about the chronic kidney disease in case of our NCLEX board exam.